Dr. Ann Childers, welcome to the show.
Thank you so much. Thanks for inviting me.
Yeah, no, I don't know how I had not been connected with you earlier. Like we have a lot of similar people and topics in common, but the reason I want to talk to you today is about primarily is about Ehlers-Danlos syndrome. I have a daughter that has that, and it's been a challenging time for us as we're new to the diagnosis and everything that comes along with it. So, tell me about Ehlers-Danlos syndrome.
Well, I can tell you a little bit about how I found out I had it. So, because this is one of those things that is very common, it's in plain sight. There are a lot of people that have loose joints, what we call loose joints, joint hypermobility issues. In fact, even on TV, I watch Judge Judy and she's going, and this, and you can see her bending her fingers like way back. And I'm thinking, part of my tribe, huh? Anyway, yeah. So it's so common, but people don't know it's around. The other thing that's really throws people off is it's not just loose joints. It affects almost every system of the body in some way or another. And so people will have all of these weird things happening, and they have no idea that their loose joints are related to that.
Got it. So, quick question to differentiate. How is
Mhm.
EDS different from somebody that has like for me, I've got like double jointedness. I've got, a little bit of hypermobile fingers. Like what's the difference between double jointedness and EDS?
Usually for Ehlers-Danlos, one or both parents have passed it on. In my case, it was my mom. In fact, she had such a sway back. Her little brother would sit like on a chair on her sway back, and she'd wash the dishes and hand them off for him to dry.
Oh,
Right?
that was wild.
I mean, crazy, right? And I have a very similar, it's called lordosis, and that's one of the things that you could have. Not everybody has all the same things. But what is the difference between having loose joints and having Ehlers-Danlos? You could have Ehlers-Danlos and not know it. Men tend to be less symptomatic. In fact, they affect 3 women to every 1 man.
Mm.
And there are lots of us that have, loose joints, anywhere between 10 and 30% of the US population. And in the United Kingdom, they think it's more like 20%. And it's more common among Asians and African Americans. So it's common. It's very
Wow.
common. It's
Wow.
just that, yeah, it's just that people don't know that it's a thing.
Yeah, it must be because, like, when my daughter got it, I was like, "What
Mhm,
the hell is EDS?" And I started looking
mhm,
into it, and it was, like, this is a new thing that seemed very rare. Like, if you look at the
mhm.
information that you can go Google, like, it will be super, super rare. And what's also been frustrating about it for me is that it seems like there's not a lot you can do about it, which is why I wanted to talk to you, somebody who is a doctor who also has it, because
Mhm.
my daughter, frankly, is very upset about the prognosis. She's 24 years old and she's, starting off her life and is kind of like she has to walk with a cane and she has chronic pain and all these really horrible things. And she's kind of like, oh my gosh, like, is this really the rest of my life?
And my heart goes out to her.
Thank you.
There are varying severities in any condition between individuals. So, it sounds like she got hit, unfortunately. But let me ask you a few things about her. Like, what are her talents?
She's incredibly artistic.
There
Yeah,
you go.
so massive, and I'm talking massively talented when it comes to visual arts, painting, drawing, all of that sort of thing. She's always been
Yeah.
very musically gifted. She's always been tilted that way. We grew up. I see you're in Oregon. We all grew, or my kids grew up in Seattle area, and so she was,
Mhm.
around the, people that were a little bit more that way inclined, and that was cool for her. So yeah, that's her like talents, what she's naturally gifted at.
Yeah.
And I've been trying to encourage her too to like lean into that because it's a little bit less intensive as sports. Like for example, if your thing was sports and you got EDS, like that might have been a little bit of a bigger hit, maybe.
Well, it depends. I mean, if you watch Cirque du Soleil, you see a lot of contortionists. but
Yeah.
they have conditioned themselves in many cases, hopefully they have done this, condition themselves so that their muscles are pretty built up around the joints and pull the joints together. That makes
That's
sense.
that does make sense, and that's the thing that I've been talking to her about that we don't really understand is because 'cause I'm kind of my first thought is you exercise. You tighten things up. You want to, strengthen all of those muscles and tendons and ligaments that are around the joints so they don't pop out and they don't get all hypermobile, and she's been struggling with what she calls flares. I don't know if you have this, but it's like if she pushes herself too hard physically, she'll crash out for, like, a week after that and have a really bad I mean, I've seen like really bad stuff. Like she's also got eczema too, and her skin will just go crazy and flare. Like
Blood clot, yes.
it's just like really like a week of solid pain. And so she's been in this state of riding like what's the line? Like what's too far? What's not enough? It's been a real challenge. Boy, I don't know if you have any thoughts on that, like from her perspective, what she could do to, get some
Think
relief.
that allergies?
She does. She has wheat allergies on top of it too. So that is another big
Yeah.
thing. So she's completely gluten free. I mean, I wish I tried to get her. She did carnivore January for like a week before she tapped out. Cause I'm thinking the same thing too. I'm thinking getting rid of all that stuff, elimination diet, go on something that's
Mhm.
very, very protein, fat heavy, very low inflammatory. That would probably be the move. But she says she doesn't feel good. She feels icky on too much meat. So I'm just like, I don't know what to do with that.
So if it was had I could give advice on this, probably the thing that helped me the most, and it doesn't have to be meat heavy, but is, paleo low carb. And I think of paleo as like an elimination diet, and then start adding things in and see if you feel worse or better over time. I think that would be a clean way to start and to see what things are bothering her, because she could be allergic to corn, she could be allergic to so many other things. So you brought me to the mast cell portion of Ehlers-Danlos syndrome. Has anyone talked to you about mast cells?
No.
Okay. Mast cells, it's called degranulation, and when they do that, they release what's called histamine.
Mm. I'm familiar with histamines.
Yeah, okay. So, uh, persons with Ehlers-Danlos syndrome or joint hypermobility overall, because some people never get the Ehlers-Danlos diagnosis. Maybe they don't have a lot of family members that are affected, or for some reason, they don't get pinpointed as having Ehlers-Danlos. And I'm not saying everyone with joint hypermobility disorder has Ehlers-Danlos, but we share a lot of these things in common, like being prone to mast cell activation syndrome, MCAS,
Mhm.
being prone to dysautonomia, POTS,
She's got
some
that
other
too, by the way.
kinds of
That's the new thing.
dysautonomia. Right.
Yeah.
And it is a pain, and we can talk about that. Also, things that have to do with loose joints in the neck that affect the cranial nerves around the face. And even I was diagnosed with loss of sensation on the bottoms of my feet from having fallen arches and stretching those nerves. Crazy, right? It's
It's
not
crazy.
peripheral neuropathy the way we think of it. It's a different kind, but it has to do with the stretchiness of the skin and the way that nerves get stressed uh, by being pulled apart, all kinds of things.
Yeah, and
So
that's what
math
I didn't understand that at first. Sorry to interrupt, but I didn't understand that at first because 'cause I'm thinking, "Okay, hypermobility, how does all of this stuff fit in?" And then when I learned about it, it's kinda like, well, you have this fascia that is really just holding everything together, and it's not the fact that the fascia goes stretch, stretch, it's what gets stretched too far or, beyond what it should, like nerves, blood vessels, all of those sorts of things, and I didn't even consider that.
Right, right, and it can affect everything. In fact, this may be TMI, but I have actually 2 chest wall deformities. I have what's called in the sternum, I have a pectus carinatum where it bulges out, and then I have a pectus excavatum where it forms a V shape and it comes in, and it has made my lungs so narrow that my heart has actually sunk down toward my floating ribs and turned backward, trying to find room to work.
Oh
So
my gosh.
I'm telling you, and we also tend to have small dental arches, so child-sized mouths that are hard for dentists to work in. Often we have weak enamels, so we may have more cavities than other people, things like that. Getting back to mast cells, I think this is a really important point because getting control of mast cells is a big deal for people with joint disorders, and that may actually play into eczema as well.
Mm.
So, very interesting. We also tend to get polyosteoarthritis. It's not a rheumatoid arthritis, it's not coming from the same place, but we could get arthritis everywhere eventually. And very interesting, there was a Stanford study. It was a study of mice. So, being what they call a murine study, it may or may not
Apply.
apply to humans, but what caught my eye is that this murine study, they said, we discovered that osteoarthritis, mast cell activation, aberrant mast cell activity is essential to forming osteoarthritis.
Mm.
Fascinating, right?
That
So,
is.
and I look at that and I think if this does apply to human beings, what if avoiding osteoarthritis is as simple as taking Claritin?
That's interesting.
Right? I mean, there may be something out there that's really good for controlling mast cells that may keep us from progressing to arthritis at my age.
So, do you
You just
know
try
of
it.
any literature around antihistamine effects on osteoarthritis?
It is used quite a bit in the among doctors who treat Ehlers-Danlos. There is something, I think I wish I could look it up. Anyway, ketotifen. And it's something that's often found in eye drops to control irritation from allergies, but it can also be compounded by a compounding pharmacist with a doctor's order to help suppress mast cells.
Very interesting. I'm definitely gonna look into that. So, talk to me about POTS a little bit. This is something new. We just went to the cardiologist and found out essentially that she's got
Yeah,
dysautonomia and POTS, and so we've got her in compression socks now, and that seems to be helping quite a bit. But beyond that, like I've been watching Dr. Mary Bowden. I'm not sure if you follow her. She got caught in a firestorm with Houston Methodist. She was an ENT doctor, and she was one of the people that got caught up in the COVID hysteria, and they went after her license and stuff because she was prescribing ivermectin and doing some things that were no nos at the time. But she claims that she has seen a massive increase in POTS symptoms in otherwise healthy adults. And young adults, particularly that have got non EDS, it's just across the board. It seems to be after what intervention it seems like this spike had happened, and she's been talking about some new treatment that is apparently some sort of stent that they put in the lower venous area. I don't remember exactly the details around it, but it feels like that's all that I've been able to find so far on POTS is like you can compression socks, have some salt, and maybe these stents going in the veins in the pelvic area or something, and that's it. Do you know anything else?
that does help. But one of the things that I think happened to a lot of people, and I think it may have happened to me because I have what's called cranial-cervical, so cranial instability. That's part of, I think, why I have the dystonia.
Mhm.
I also have atlantoaxial instability, the first and second. So Atlas holds up your head. It's
And the
like Atlas
axis
holding the
turns, right?
world,
Yep,
right?
Atlas and the axis does the turning, right?
And the axis is like this, and it's supposed to be straight, but mine wiggles
Mm.
and it's hitting my brainstem. So sometimes I will have like good days with POTS, and sometimes I'll have bad days with POTS. And and it can actually come from back here, from cranial-cervical
That
disorders.
actually makes a ton of sense because the brainstem controls all those autonomic functions, your heart rate, your breathing, all those things that are subconscious, functions, so that completely makes sense. Oh my gosh, that's terrifying.
Well, the guy who did my autonomic test, tilt table test, and then
Mm.
also tested for other, things like, um, peripheral, problems with numbness, tingling, things like that. Anyway, he had me I was standing up and I was doing just great, but at minute 6, my neck got really weak, so I probably was starting to go into what happens with POTS. With POTS, when you stand up, instead of your blood pressure going down, it actually soars. It actually goes up while you're standing, usually within 10 minutes. And there's some nice online stand tests that people with who think they may have POTS can take at home with a blood pressure cuff. I think Ehlers-Danlos.com, it also addressed joint hypermobility of any kind, except for I don't think they really talk about Marfan, that's a different type, but, anyway, joint hypermobility, spectrum disorders, as well as Ehlers-Danlos, and I thought they may have a stand test there. But what happened with me is my neck got weak, and I said, "Is it okay if I bow my head?" And I'm gonna not gonna do it on on this podcast because, uh, my blood pressure dropped from 128/85 to, 80/40.
My, that is
Right?
critically low.
Yeah. So, the poor guy who was doing the test panicked a little. Uh, he stopped the whole thing, and he carefully escorted me down the hall, and I thought, "Boy, I'm really glad I didn't pass out." But that's how just something very simple as the neck can play such a huge part in symptoms. But that's not for everyone. That's, that may be just something that happened to me, and also I've had patients myself who are young, in their early 20s or even 20 or 19 who have already had their necks fused, who have
Mm.
had Ehlers-Danlos syndrome. So I think the neck should never be overlooked. They should at least do some flexion and extension and side to side x-rays to see how things are, I think. At least that's what my doctor did for me. So this is not really medical advice. I just want your audience to know that. I'm just telling you my experience
Yeah, yeah,
and that I
completely.
know that it can be a problem. Yeah.
So I got a couple of things queued up that I wanted to sort of pivot back to. The first one is you talked about spectrum disorders. Tell me more.
There are people out there who do have joint hypermobility, and they may have POTS, and they may have MCAS, a mast cell activation syndrome, but may not quite meet threshold criteria for Ehlers-Danlos syndrome.
Oh, okay, see,
Maybe because they don't have.
when you said that, I
Yeah.
thought you meant, like, autism spectrum disorder. I thought there
No,
might have been
it's
a link
the
there. Okay, cool, cool.
the
So,
hypermobility spectrum. Mhm,
just wanted to double click on that. Second one is, I wanted to talk to you about the tilt table because my daughter is scheduled for one and is
mhm.
terrified of doing it. I don't know a whole lot about it. So maybe you could talk me through what is the tilt table test? What is it like? And what is the purpose or what is the function of it? What are they trying to identify through that test?
What they're trying to find out is what happens when you lay down versus what happens when you're more upright and when you're standing. And they can get a lot of information about that. They can certainly, they are taking a lot of measurements at the same time, like blood pressure, pulse, trying to see what's going on with your body while you're in the tilt table. But you are strapped in. They're not gonna have you. It's safe, and they're watching you the whole time.
Is there some component of IV drip and things like that with it?
No, not that I did, but they did do some put some liquid, uh, on my arm, and it was just this little kind of like bubble over some liquid. And with that, they could tell if I maybe had some peripheral neuropathy because
Mm.
the thing is, people a lot of your standard physician when he hears peripheral neuropathy is going to wonder about your nerves or if there's a problem with diabetes or kind of the typical things. But a lot of persons with Ehlers-Danlos syndrome do have peripheral neuropathy.
And is that
So
because of
and
what
they
we
don't
talked
accept.
about? Like, is that because of the fascia stretching too far and damaging the
Yes,
nerves,
it
pulling the
can
nerves
be.
further than their range of motion?
Yep, there are lots of reasons for it. Mhm.
Got
Yep.
it, got it. So
Yeah, and I was told that the nerve on the side of my leg was also involved in my lack of sensation and also some function, and it had to do with stretch. Um, so things get so stretchy and so difficult in terms of function that persons with Ehlers-Danlos, you may see them trip or skid because they turn their ankle all the time.
yeah,
And so they may need a boot or something to kind of stabilize. And there's some very fashionable boots,
that's the
right?
important part. Yeah, I've got a young daughter, and she definitely wants to stay fashionable. She, like, decorates her cane and all this stuff. It's very fun, but
Absolutely. Oh, yeah, go for it. I had to wear, I was doing ballroom dance and I had torqued my knee in an icy parking lot. And so I had to wear a brace. And I thought, oh, heck with this. I'm going to bling it out with Swarovskis,
there you go.
crystals.
Let's do
We are
it.
going to go a blinging
Jeez.
because it's people so young. I mean, they need to enjoy their life and do the things they want
Exactly.
to do.
Like my daughter said, "You need to have some whimsy in your life," and so, yeah, go for it, do it. It's what you need.
She should write it down. She should write these things down.
That'd be interesting story because yeah, once she gets through this, she's gonna have a hell of a story to tell. I do have some questions from her though. So she wants to know how
Okay.
she can optimize her sleep. I guess sleep has been a very big problem for
That's
her.
huge. Sleep is She may need a sleep study. About
Mm,
30% of us have sleep apnea or related disorder, and it's not necessarily because of weight. I have severe sleep apnea, and you can say I have this scrawny, skinny neck, right? The problem is that the tissues and the organs in the back of our throat just sag,
mm.
and they don't allow us to get enough air at night. Um, I would s For me, of course, I may be but I
Oh,
think everyone with
r-
Ehlers-Danlos should be tested.
be careful of the hitting the phone or whatever. It becomes very loud when you touch the phone. So just FYI.
Oh, so sorry.
No, no worries. No worries.
Thank you.
Lost a little bit of hearing on that one. Cool. So the sleep has been a very big thing for her, and that actually
Yeah,
makes sense. We did not even consider that, but now that I think about it, she often complains of the difficulty going to sleep, but also when she
she
wakes
is
up, she doesn't feel rested. She'll be like, "I still feel really fatigued when I wake up in the morning." That's one of those standard things you hear from people with sleep apnea because they're fighting for their life in the middle of the night.
well, and here's the thing, women with fewer symptoms than men have of sleep apnea, or let's put it this way, when tested, they may have a milder case of sleep apnea, but they tend to have greater daytime symptoms.
Mm.
We get hit harder. And then the other thing is there is airway resistance in women because we tend to have a longer airway. And sometimes that causes problems, even though we don't have a lot of breath holding during a test. So it's
Got
really
it.
important if a woman gets a test, it's really important that they be tested by someone who's aware of the stark differences between how men present and how women present.
Are there EDS specialists out there? Because it feels like we've been going to the GP and then this specialist and the cardiologist and kinda like being shuffled around, and I wanna know if is there anyone you know of that, like, specializes in this, or is it just not enough diagnosed cases for it to be like a valid specialty or a specialty that would get enough critical mass that doctors would wanna pursue it?
Sadly, we, the double jointed, are everywhere, but the resources aren't everywhere. That is a problem. However, if you go to Ehlers-Danlos.com, they do have a list of physicians all over the US who tend to specialize and hone in on Ehlers-Danlos syndrome. I'm fortunate that at the med school that I graduated from, Oregon Health and Science University, there is a naturopath at the pain clinic who's an associate professor who specializes in Ehlers-Danlos syndrome. So sometimes you'll find these niche people. Do you have a medical school nearby?
Oh, yeah, I'm in Nashville. We got Vanderbilt Medical Center, like, right down the street.
Well, hello. They better know something.
Yeah, I mean, that's where we've been going, but like I said, we've still been and maybe we just haven't I haven't gone to that website and looked for somebody who specializes in it, but, so far, it's been like I said, it's been GP to a whole series of specialists for a whole series of tests, and it's been really
Right.
frustrating for her because I think she's known for a long time something's been wrong,
Yes.
and it's all been very squishy and amorphous and difficult to pin down, probably some comorbidities on top of EDS as well. And so, like, it's tough, man. It is really tough to find quality care, but I feel like we're starting to get on the right track.
What you'll end up having is a team. You can't avoid it. It's just what happens, because so many systems are involved.
Yeah, like
So,
she's mentioning gut issues. Do you have any thoughts on gut
yes,
issues? Because yeah,
absolutely. I'm going to advocate for women everywhere, especially women of reproductive age. She needs a bidet. She needs a
okay.
bidet. All right. So, first off, she needs a bidet just because she's reproductive age. I mean, it's just such a wonderful way to take care of oneself. It's important. But also, a lot of these bidets have functions where if someone has a really slow GI system, they can actually, um, they can actually, because some people have a really hard time doing that. And it can get serious. It can get to where the colon is really big because of packing so much stuff in there that they can't get rid of. So I think that is a very good thing. And it's a sensitive subject, right? But when you travel, you have to have something with you that is going to help you be able to do a daily function. Things like that for a lot of us. Yeah. Also, stomach upset. I always get that with POTS. And I hear that also from my patients. Nausea is very common. People stand up and they'll go, "Whoa, I've been standing too long brushing my teeth. I've been standing too long doing something else." They'll get nauseated and feel very lightheaded. Yeah. So taking care of one's gut is really important. Making sure that you know what foods feel good on your gut and what foods don't. For me, fermented foods like kefir and things like that feel really good. Some people, of course, are allergic to dairy, so they can't do it. But you can do a fermented coconut. So there are actually coconut yogurts on the market that have live bacteria, things like that. Those often help quite a bit. They're pretty simple. The other thing, as a kind of a prevention for POTS, one of the things you want to do is get some pressure around the gut because
Mm.
there's an area that tends to pool blood in the gut. It's called splenic pooling. And so what I found, since my hands are kind of too weak to pull up a medical garment, what I would do is put on 2 sets of Spanx that go from my chest down to mid-thigh, and those would hold.
Well, you just preempted another question she had, which is Garments, like, what should I do as far as garments go? Because
Right.
I think we just got the knee-high compression socks, and that changed her life. She was like, "Oh my gosh, this is like night and day better," and so I think she's yeah, and she also mentioned, I think, some similar thing, like, sh in her lower belly, she was always like, it's always been kinda distended, and she didn't know if there was something related to EDS with that, and it sounds like probably.
Yeah, could be. So the other thing is periods for women who have Ehlers-Danlos can be very, very heavy. And so it makes it easier for us to become iron deficient. So anyone has Ehlers-Danlos who has what's called menorrhagia, they need to talk to their doctor about what the remedies are, if any, right?
Mhm.
And also how to prevent iron deficiency anemia.
Yeah, that's a big one. I think a lot of people are not aware how deficient they
Right.
are with respect to a lot of things, whether that's vitamin D or
A lot of
iron or
women don't know. Yeah,
yep, and there's only one way to find out. You have to test your blood, right?
right.
Well, cool. Hey, do you have a number 1 tip? Is there a number 1 thing for managing EDS that you can think of, or did we already cover it?
I don't think I mean, there are so many number 1 tips, but when you talked about how she gets wiped out from some activities and sometimes has to recover for a week, that is really common. That's really common, and there's a spoon theory of Ehlers-Danlos that you have only so many spoons you can spend, and you're gonna spend 1 spoon getting dressed, and you're gonna spend 1 spoon doing something else. Just figure out how many spoons you have in your basket and take care of yourself. If you have spent your spoons, go, like, have a cup of tea, watch a movie, you know, do something for yourself that makes you feel good. Engage in your hobby if you have enough energy to do it. If you don't, do something that pampers yourself. It's really important that, especially if you're gonna work hard, that you have some kind of outlet, at the end of the day that makes it all feel worthwhile.
Yeah, that's good advice. And I want to ask you this because I'm seeing the connection here from A to Z is you're a medical doctor.
Right.
You have the same thing she does, and you're still functioning. You're doing it, right? And I think that her biggest worry is that she's going to be disabled forever, not going to be able to have a fulfilling life, not going to be able to have a career, not, all the things that you're worried you're not going to be able to do. So, how do you do it? How do you manage?
So it's different for everybody. My symptoms may not be her symptoms. Interestingly enough, I didn't start medical school till I was 33 because like a lot of people with Ehlers-Danlos, I have ADHD and learning disabilities, but also a crazy, quirky creativity side and am kind of a pattern thinker. So somehow I got through med school at age 33.
You're my people, by the way. I just wanna say this. You are my people. I'm the same way. I took me an extra year to graduate high school, and I got
Right?
no degree in anything, and now I'm working for, like, this massive tech company and doing really well, and so I love people that are unorthodox. They come about it a different way.
Mhm.
Maybe they think about things a different way, see the world a different way, a little bit weird. You're my people.
I think that's why I never became certified because I had these off the wall answers and some things didn't make sense to me, but I digress. But I've had a very good career in my 70s now. So I'm kind of done with that. Knock on wood, I actually got through without making any big errors or causing, people pain and misfortune as far as I know. So that was ending on a pretty high note. Um, One of the things that I'm grateful for, I was invited to become a surgeon at OHSU, and I hope I did it the right way, that I, gently declined. And I'm flattered by that, but I actually thought they didn't know that I was a mediocre student, so I tried to point that out to them, thinking I didn't want to embarrass them, right? But they had seen me perform in surgery, and I got honors in that. What I'm getting to right now is I'm glad I didn't. And I'm glad I didn't because My personality is more introspective and more pondering, and I think in an emergency, that's not what you need. But also, I don't think physically I would have held up
Mm,
standing at a table for 9, 10 hours a day. So I think part of getting a good career is knowing what your limitations are. So I sat in this captain's chair here, and I could lean back, I could stretch. I also wore it's called a body braid. Have you heard of it?
I have not. Tell me more.
Gotta go check this out. It's a big strap that's stretchy that wraps around it can wrap around your arms, it can wrap around your legs, it can wrap around your midsection, it pulls your shoulders back. It helps you stay in alignment, and when I wear that, I feel like I have more energy.
Interesting.
So if I have to sit for a long period of time, I wear my body braid.
Wow, that's interesting. What is body braid like? Can you describe it to me? What is this thing? I'm having a very hard time
What it
picturing it.
does is it pulls the joints together in ways that my muscles don't.
So it's just supportive. It's just extra tightening.
Supportive. Yeah, extra support, and for some reason, I just feel like, "Ooh, I have energy." When my
Interesting.
joints pull together.
Okay. Another question for you is
Mhm.
jaw joint or are jaw joint problems an EDS
Yeah.
thing? Oh, okay. Okay.
TMJ. Almost I mean, I don't know what percentage of persons have TMJ who have joint hypermobility, but I'm pretty sure it's high. And in fact, oh, my poor dentist. You need to get a dentist who's familiar with how the jaw sets so that if they give you because we tend to grind. If they give you a, protector for your teeth, it has to fit. If it does not fit, your TMJ will flare up and peaking will happen. It actually happened on this side for me. I can still hear it. It still grinds, but fortunately, I'm not in pain anymore because I got a dentist who perfectly aligned it. So that's another point. When people do routine things a lot of times for the person with joint hypermobility. That's not what should be done. And that could be chiropractics. Very important that you get a chiropractor who understands loose joints.
Yeah, that was
Otherwise,
I was gonna ask that because it seems to me to be counterintuitive that if you have loose joints, you should be manipulating them mechanically. You should be sliding them around. It feels to me like that would make it worse. Why is it not true?
it's not true because they could actually stretch things. And once things are stretched, a lot of times they remain that way.
Right, that's what I'm saying. Like, it doesn't seem like to me, it seems risky to take somebody with hypermobile joints and then intentionally start sliding them around. So I guess what you're saying is like you can and there's benefit to it, but that you better damn well be knowing what EDS is and all the
That's right.
way things to do, things not to do. Right.
Right. Exactly. Exactly. Yeah. So I think uh, getting a team around you that really understands what you've got to take care of it. Also, surgery for us often doesn't work. And especially if it's on a joint, it can actually make things worse if the person doesn't know how to handle fragile tissue. They may have to go slower. They may have to be more observant about how the tissue's responding to the cut, things like that.
Got it. So I want to talk about the genetic component because I'm confused about this. I'm told that EDS has got multiple variants and there's one that's like super rare,
Or
but it's super deadly, the one that affects the cardiac system. And these people essentially die at like 40 all the time, which is like super scary. What can you tell from genetics? Because we haven't gotten there yet, and I'm just curious. Like, they say there's some genetic tests. Like, what can you find in your genes, and what can that tell you about what type of EDS you have? Like, what do you look for?
well, the most common type is type, the hypermobile type. And those are the people who don't have widened what they call widened atrophic scar. It's a scar that looks like a mouth, and inside there's, like, cigarette paper tissue looking looks like cigarette paper. It's very thin, very, very delicate in the middle of the scar. Those with a hypermobile Ehlers-Danlos don't tend to get that, but what they do have is, for example, when they go to the dentist, the local anesthetic may disappear really fast, so they start having dental pain because yeah,
They
and
just, like,
things like that.
metabolize it too fast?
I don't know what happens exactly, but for some reason, it's not as effective as it should be. I've had that
Interesting.
happen actually. Yeah. So that's the most common. And the inheritance on that is what we call autosomal dominant, which means if one parent has it, probably half the kids are gonna have it. Although in my family, all the kids got it. Um, yeah. So very interesting. So if one parent has it, if both parents have it, chances are pretty high that all the kids may have it.
Wow.
So autosomal dominant. So that's why I think it's not that rare because now we're in an age where childbirth is really tricky for a lot of persons with Ehlers-Danlos syndrome. They tend to have bleeding problems. There is a bleeding, what they call dyscrasia, that causes easy bruising in a lot of us with hypermobile
She's got
Ehlers-Danlos,
that too. Yep.
lots of bruising going on,
Mhm.
right? So, so anyway, for us, it's really a joy because we can blame one or more parents
I've heard that already.
or on our fingers, right? Anyway,
I'm like, "I didn't pick. I didn't pick. It's just a dice roll, man. Sorry."
but just think, along with that also comes the creativity and all the other goodies that come with that. So it's not all bad.
Yeah,
And
yeah.
like I told, go ahead.
Yeah, so for sure, it's definitely not bad. So go continue what you're gonna say. I have another topic to pivot to.
Yeah, like tell some people, I say, doctors don't like to see us coming, but we're worth salvaging. We can actually be contributors, and most of us wanna be contributors, so, yeah,
Yeah,
anyway.
and that's really sad because that's where her heart is at right now, and feeling real bad about herself. Like, is this just my life? Am I going to be able to have a romantic partner and a family and a job and all these things? And it's like, dude, this is really tough to see a young person to struggle with. And I think the biggest issue is probably the pain. So, talk to me
Yeah,
about chronic pain. Like, we haven't really
chronic
touched on
pain.
that yet.
Yeah, I think, chronic pain and the thing that about the chronic pain is we go to the doctor, and the doctor says, "Where's your pain?" "It's here." "How severe?" Scale of 1 to 10. It's a 7 or an 8. They do their examination, they send you in for imaging, they come back, they go, "There's nothing wrong." So
Uh,
so what are we talking about here, right? So it gets, on the one hand, as patients, we are often what we call gaslit because we're told there's nothing wrong, but on the other hand, the physicians, so few physicians, even rheumatologists who study joints. I think only 1 in 3 rheumatologists right now even know anything about Ehlers-Danlos. So it's hard to find somebody who really gets it, and then it becomes really frustrating for the physician who feels like they're being gaslit.
yeah, and as a
So
physician, you probably have to worry about people that are hypochondriacs, right? So that is a insignificant portion of your client base, right? There's people just come in and or people that are just lonely, wanna talk to some whatever. There's a bunch of things that you
right? But you mentioned hypochondriasis, and a lot of us become hypochondriacs because we feel like the doctor knows something and he's scared to tell me what the
Mhm.
real problem is. Or I keep going to these doctors and now I'm really frustrated and my pain feels worse. And so I must have cancer. Nobody's telling me. I actually thought that once. It was pretty funny. Funny
Yeah,
now.
it
Hindsight,
makes
it wasn't funny at the time.
yeah, well, it makes sense because, if you put yourself in somebody's shoes that has a complex illness that's very hard to diagnose and you're not really getting much from your healthcare team. It's just like
Right.
everyone's doesn't really know what to do, and this, test that, and they're getting very frustrated. And then you have to think, okay, something's really wrong with me, and these professionals can't figure it out. What is it? And your brain, you're probably on YouTube all the time looking at videos, and maybe I got this, I
Yep.
got that. And it just spiral, probably causes a ton of anxiety for people. I'm sympathetic to folks that are in that boat because man, it's frustrating to know that there's something really wrong with me and no doctor
Yes.
can put their finger on. We look at doctors oftentimes. I know you are one, but as a patient, you look at it like, well, you're like God. You should know everything. You went to all that medical school. You should have this all pinned down. But boy, I mean, if you know anything about human biology, like we know nothing at this point. We're still, banging rocks together and sticks together and hoping for the best with respect to like all of the biological complexity. We just don't know much about the body yet.
We're still learning stuff. In fact, there have been a couple of brain anatomy discoveries just in the last, I think, maybe 10 years, 10 or 15 years. It's
Really? I didn't
crazy.
know that.
Yeah. So anyway, so this is the plight of the person often with who may have Ehlers-Danlos. They think so many things are wrong, and how could this happen to one person? How could all of this happen to one person? Migraine headaches
Mhm.
and cluster headaches and tension headaches. And this is very, very common with persons with Ehlers-Danlos. A lot of times it's coming from the neck, can be coming from a lot of different places, but also the looseness of the joints set up a lot of tension. The muscles will actually cramp trying to keep everything in place. If if for people who have a lot of the cramping and the headaches and things, I think one of the things that is worth trying is, and check with your doctor, make sure that you're a candidate for this, magnesium citrate.
Why citrate?
Just because it's more easily absorbed. Magnesium oxide and hydroxide, you'll only get maybe 4% of that.
Yeah, got it. So, like, I think glycinate is probably the most common right now. I think magnesium
Yeah,
glycinate
a
is the
lot of people
thing.
like that. Sure, but citrate is probably a good starter.
Got it.
One of the things about hydroxide and oxide also is they may end up, being more like laxative effect.
That was milk of
The
magnesia, right? Like, isn't milk of
Oh,
magnesia,
yeah,
like, literally
of
magnesium?
course, right? MOM? Oh, yeah.
Yep, yep, yep.
So anyway, it'll help people be more regular in terms of bowel movements every day, which is really great. But it also helps loosen up some of these really tight muscles that are reacting to joints that are slightly out of place.
Right,
I
right. Because
mean, I don't know
magnesium
about
doesn't
yeah,
magnesium act as, like, a muscle relaxant? That's one of the
yeah.
functions? Got it.
And it helps with headaches for some people, not everyone, but perhaps as many as 50% of people with migraines are magnesium responders. I turned out to be one.
Wow.
I'm very happy about it. I haven't had migraines more than
Well, cool. I wanted to reserve for some time at the end because I know you wanted to talk about this. Tell me about continuous glucose monitors. Why are you interested in
okay.
this?
Because, well, I personally I'm a recovering addict. So my shopping cart was full of pie cherries, angel food cake, pudding. I don't think there was real food anywhere in there, and I am not kidding. Meringues. I had a sweet tooth like nobody's business. I don't know that that's an Ehlers-Danlos thing because there are a lot of people that have that. But my mom was that way. She'd sit and drink Coca-Cola, eat these candies, and she weighed 102 pounds soaking wet, skinny. So anyway, at 5'6", 5'6". So I guess maybe I got that from her, but anyway, I just had a terrible sweet tooth and just was carbohydrate loading every single day.
How was your
It was
childhood? If you don't mind me
honestly
asking,
yeah,
so curious, how was your childhood? Do you have a good childhood? Not okay one?
it was a little dysfunctional, but I sort of avoided a lot of the situations that could have gone south by having a lot of friends and going around the neighborhood.
The reason I ask is that I grew up with severe child abuse, and I've
Mhm.
been studying the literature. I've been studying
Mhm.
everything I can get my hands on about that, and a lot of us end up the exact same thing you're talking about. You use that dopamine spike to self-soothe, the
It could have
treats, the
been.
candies, the sweets, and oftentimes that's a pattern we develop in childhood. So I was just curious. I don't want to pry too much, but that little thing sort of ticking in my brain. I'm like, maybe.
Yeah, one of my coping mechanisms was befriending dogs and cats, and one of my first jobs was for 60 cents an hour. I would actually watch this lady's cat and dog, and then I would take that money and buy candy. First thing that I did, right? So anyway, so having grown up that way, I I had a stroke in 2003, and then in 2000, I think 2004, I discovered that I had a glucose intolerance. So I did
Mm.
the oral glucose tolerance test, swallowed the glucose, and then I thought, "Oh, no, I'm going to have to change my wicked ways." I don't want to be like 60 and completely decrepit. And that is where I was going. So anyway, so that is when I changed my diet and I started, even though it was the low fat era, I started eating whole foods, whether they had fat in them or not, and gradually going off until about in 2006, I adopted a ketogenic diet and actually almost had a meltdown in the candy aisle when I made the decision. Right? I was in the candy aisle when I made the decision, and, it was emotional. So like you said, that was my
Hard to let
crutch.
go.
That
Yeah,
was
it's
my
hard to let
crutch,
go.
right? But once I started eating whole foods, I'm not saying everybody should be keto, please don't misunderstand me, I don't think that's right. I think some people have better metabolism, a lot of people probably better metabolism than I have. But I did that for myself and have not regretted it. So that was kind of the start of my journey into looking at nutrition and sleep and how do these things affect people and how can I better optimize for my patients.
Interesting. So that was the beginning. We
Mhm.
sugar, no, no, we gotta stop that shit. Talk to me about the continuous glucose monitor. How did that come into the picture, and why are you so interested in that?
It keeps me honest, right?
Is that what it is?
Yep.
Is it
Yep.
like because you got that thing in your arm that if I cheat and I go buy the bag of Twix, I'm gonna see a giant spike in my blood glucose, and this is not gonna lie, I can't avoid it.
No, actually, here's how it goes. It's talking to my phone. So if I want to see where my blood sugars are, I just open up my phone. And so fortunately, because I have an over-the-counter glucose monitor now, I don't have all of the warning tones and things like that in the middle of the night. "Oh, your blood sugar's too low."
Yeah,
Yeah,
because those are made
for
for
type 1
diabetics,
diabetes,
right? Yeah, yeah, we're like life and
type
death.
1,
Yeah.
yeah.
Well, talk to me about that because I don't know much about CGMs. I know that I think I had
Mhm.
who did I have? I had Dr. Tro on, I think, and he was talking about like,
Mhm.
well, we can just get you one. You can call in. We'll get. I never did it. I was always curious about it, but I didn't think it was actually truly over the counter. I thought you actually had to have a doctor sign off on it, or is this one of those things where you can just call in and say I want one, and they write it for you?
Sure, you can buy one on Amazon.
Really? Like, what do you use?
Yes,
What type of one do you use?
as of last summer, you can now buy them on Amazon.
That is really cool. I
Over
did not know
200.
that.
Yeah, yeah,
Because
and
really the
if
only
you
reason I haven't gotten one so far was just the friction. I'm a busy dude and I've got stuff going on and I don't have to call Dr. Tro's office and go through I got and that's but if I could just get it off of Amazon, wow, that's
yeah,
incredible.
and then you don't have to have the alarms and stuff that type 1s, absolutely
Right.
need to stay alive, so that you won't get awakened in the middle of the night, and
Yeah, so I'm
so
not trying
you
to get
just
you to
watch
pitch
it.
sorry, I'm not trying to get you pitch like a particular thing or not. I'm just curious, like what brand do you use? And because I'm interested in taking a look at it because I don't know anything about them. What should number one, what do you use? Number two, what should a consumer that's interested in CGMs be looking for?
So, if you want a CGM that's gonna either talk to your Android or your other smartphone or your Apple phone, then probably Stello is what you're gonna be looking for.
Stello is a brand?
It's the name of the glucose monitor, and it's
Okay.
from Dexcom. Dexcom is the
Dexcom.
brand.
Got it. Got it.
And if you want one that just talks to your Apple iPhone, I think Lingo has not made it to the Android market, but I could be mistaken. Please vet me on.
Okay, cool, cool. And so when you said it transfers data. So does it just
Mhm.
do it via Bluetooth? I've also seen people like touch the phone to the tap it or something. Is that how you do it? Just sort of sync up?
No? Well, that's what you do initially. So you basically wipe your skin with alcohol really well, and then you load up the device, and then you just stamp it on. I usually hold it there for about 10 seconds and then pull the device away, and I've got a little button on my skin. That's my
Huh.
glucose monitor.
And then they
Yep,
have like those like little neoprene sort of patch things that goes over it, right? To kind
they've
of
got lots of cool patch.
all right. Well, how much does it cost? That's an interesting thing too. I don't know how much, like, because there's got to be obviously you buy the whatever, or the dots, whatever you stick into your arm, and then you have the app, and like, there's got to be some like system around it. I want to know like the pricing model. If you could, I don't know if you have the information in front of you or at least rough estimate. I'm just curious, how much does cost to do?
In my experience, the lingo that I use now was a lot less expensive on Amazon. So that's why I went there.
So how often do you switch it out?
It's every 2 weeks, and really for anyone watching us, 2 weeks is a huge education about the way your body's working. Now there are some things that glucose monitor might not pick up, okay?
What do you mean might not
So
pick up?
so when you look at a blood sugar and it looks normal, you may assume that you have a normal blood sugar. But the only way you can actually tell if that blood sugar is absolutely normal is to also measure insulin. But this device doesn't measure,
Of course not. You
right?
can't even hardly get fasting insulin tests. Like, I went to the doctor for my annual physical, and I was like, "Hey," because my A1C came way down when I went to the carnivore thing, and it's like
Mhm.
I'm like, "Okay, but I don't know. I don't have a baseline for what my fasting insulin is. Can you get me a test for fasting insulin?" And the doctor says, "It's not indicated, so no." And I was like, "Okay, that's fine. Can I just pay out of pocket?" And he's like, "We can't. There's no." I was like, "I can't do that." And I'm like, "What do you mean you can't do that? Can't you just like I'll pay for it?" And I actually had to go out of my own pocket. I'd go through a different, I think it was like the ownyourlabs.com or something. I set up with, the company, I forget what company it was that took my blood and everything, but like this is ridiculous that we can't even get something like a fasting insulin test at our doctor. So well, I wouldn't imagine that a device would be doing it either. But boy, wouldn't it be great if we could measure our insulin levels just like we could our blood sugars? Man,
If if you can get someone to do it. I used to do this with my patients and I learned so much. Joseph Kraft basically said if you're going to do an oral glucose tolerance test in the lab, do also take with every data point of glucose that they measure, also measure insulin at that point.
yeah. So why? I know why, but I want you to tell everybody why. Why is that important?
A lot. Okay, for example, let's say I have really normal looking blood sugars, but I'm gaining weight. So if my blood sugars look so normal, why am I packing on all this weight? And so if the doctor did the oral glucose tolerance test plus insulin with every data point, they may discover that I have a normal glucose curve or almost normal, but my insulin is huge. That
It's just
my
cramming that
pancreas is
sugar
just
into your
pouring
cells as
out
fast as they can.
as fast as it can go, and eventually those little beta cells, they're gonna burn out. We think they actually change into other cells. It's almost like, "I hate being a CEO. I think I'm gonna go to the mailroom."
I did not know that. I did not. So the beta cells actually will shift into a different type of cell.
Yeah, that's part of one of the theories. I don't know if that theory is held up to this very day, but, that was one of the theories, and I thought it was an interesting one.
Yeah, I think a lot of people don't understand glucose and insulin, the relationship they play, how that works. I
Mhm.
know Jason Fung, Dr. Jason Fung had oh my God, one of the best presentations ever on the two compartment problem. And I would highly recommend everybody give that a listen because it really explains what's happening with your glucose, trying to shuttle that away into your cells, why you get fat, why it causes weight gain, why hormones, i.e., insulin, are super important and especially maybe even more important than caloric intake. That is always a subject of debate, the calories in, calories out versus hormonal influence. But at least there is definitely a hormonal component to insulin resistance, metabolic disease, and weight gain. Well, cool. I think we're about at the end. I really, really appreciate you coming on the show. This has been such a fascinating conversation. I really appreciate this is from the bottom of my heart, seriously, and my daughter as well. Thank you so much because this is a very painful thing to go through, and it's a very confusing thing to go through, and there's not a lot of resources out there. So just even for my own personal benefit, thank you so, so much, and I hope and pray that somebody else out there is gonna get something out of this conversation as well.
Thank you for inviting me. I get my kicks from sharing information with people that helps them, and if even one person is helped by this broadcast, um, I'm I'm grateful to have had the opportunity. Thank you.
Absolutely. So why don't you tell everyone where they can find you online?
Okay. So I've been spending quite a bit of time on X recently. So if someone wants me to DM them and they just catch me, a lot of times I'll follow them so that they can ask their question. Let's see. Mostly though, what I've been doing is a lot of lectures, like I was on the low carb cruise this last summer. I also lecture at the Oregon Psychiatric Physicians Association on subjects like this. Uh, anyway, anywhere they'll give me a soapbox, I'll go.
Perfect. Well, I hope you get more because you've got a wealth of information, and I encourage everybody to go follow Dr. Ann. You're great. Thank you so much for stopping by.
All right, you take good care.
You too.
See
Bye-bye.
ya. Bye bye.